Lymphedema is one of those dreaded complications from breast cancer surgery that is more likely to occur when we do extensive surgery under the arm, including axilla dissection and radiation treatment. Lymphedema is an accumulation of fluid in the arm, or lymphedema can occur anywhere in the body, often in the limbs. It occurs from a buildup of fluid, watery fluid in the tissues, because the lymphatic drainage from the arm is not working normally. So oftentimes it's, the lymph vessels are thin, clear, water-filled tubes that drain lymph from your arm. When you're in an airplane or your arm's not moving normally, sometimes when you wake up in the morning you notice that your arm or your hand is a little bit swollen. That's a little accumulation of fluid. So if you take that and make it much more noticeable, it becomes lymphedema. The whole arm swells. That's because that fluid can't get out of the arm because it's affected, the lymphatic drainage is not normal. So you get a buildup of fluid in your arm. And that's often very debilitating, and it's not curable. If we diagnose somebody with lymphedema of the arm, we're sending them for physical therapy, including regular massage treatments. Sometimes the arm goes in this pump device that pumps the fluid out of the arm every day. The arm is swollen. Oftentimes we wear compressive garments. It's not something you want to have. So in anticipation of that, we use what we call our LDEX machine. LDEX stands for Lymphedema Index, and basically we have a machine in the office that measures the impedance of the arm. The impedance is basically related to the fluid in the arm, and it measures the conductivity of electricity in the arm at multiple frequencies, and it can pick up lymphedema at the very earliest stage before oftentimes the patient has any symptoms. And before the doctor can diagnose it, we can pick up this abnormality in the impedance. So we have our LDEX machine, and we discuss this with the patients, and oftentimes we're doing the LDEX regularly every 3 months in post-surgical patients, so we can pick up lymphedema at the very earliest stage. There's some research that shows if we can diagnose it before there's any symptoms and treat it oftentimes with a compression garment, that we can stop lymphedema from becoming a chronic problem, which is, an excellent thing to do. And before we had LDEX, it was not something we ever had the opportunity of doing. So it's changed the paradigm when it comes to lymphedema.